cardiovascular system from anatomy physiology. Then we have completed our respiratory system, skeletal system, digestive system, skeletal system, and lymphatic system. These 5 chapters from anatomy physiology has already completed. Now today we are going to see 6th chapter, cardiovascular system. Cardiovascular system is one of the system that communicates throughout the body. So each and every cell or each and every organ of your body will receive a blood. Blood is nothing but the fluid connective tissue. So the connecting medium with your cells and tissue of body, that is nothing but the blood. Okay, cell, tissue, organs or system, nutrition, sugar, energy, carbohydrate, proteins, lipids, that are biomolecules, then vitamins, etc., etc. So everything, all the nourishment or all the nutrient to each and every single cell, then organ, then tissue, and then organ, and then system. So every cell, tissue, organ, system, they used to get a nutrition from this connective tissue known as a blood. So from blood they used to get nutrition, and in the blood itself they used to deposit or they used to pour their waste material, metabolic waste material. So what is the metabolic waste material and what is nutrition? Okay, so nutrition is like that your glucose, then glucose, different kind of proteins, different kind of lipids, vitamins, etc., etc., minerals. So that is a nutrition. So every cells, every tissue, every organ needs a nutrition that is supplemented via blood. Now these cells, tissues, organs or system, so whatever their metabolic waste is there, so that is deposited in the blood again. Mainly your cells, tissue, organ needs oxygen. They needs the oxygen for their various metabolic process. Now that oxygen is also carried out by this blood. So nutrition along with the gases, they are carried to a various cells, tissue, organs via blood, and metabolic waste like carbon dioxide and other metabolic waste, that is deposited by these cells, tissue, organs, and system in the blood. Now that blood is continuously flowing throughout your body. Blood is continuously flowing throughout your body. Okay, and that blood is pumped by your heart. Okay, heart is a pump known as a heart is a pump. It is actually a double acting pump. So it pumps the blood throughout the body, it circulates the blood throughout the body, and the tissue, they will take the nutrition and they will uh, deposit the waste in that blood. Okay, so that is nothing but the cardiovascular system. So cardiovascular system is the system which circulates the blood throughout the body. Now there are different kind of circulations. So systemic circulation means what? Systemic circulation is also known as a major circulation, and it is for exchange of gases into the blood. Okay, into the lung. So whatever blood that is being pumped into the lung, whatever blood is that is being pumped into the lung body, various body compartments, your cells, tissue, they will exchange gases, they will exchange the oxygen with the carbon dioxide. So oxygen, they will take oxygen and they will excrete carbon dioxide in the blood, and that is nothing but the major circulation. Major circulation means exchange of gases within the blood and your body cells or tissue, that is a major circulation. And then minor circulation is also there. So minor circulation is known as a pulmonary circulation. So exchange of oxygen and carbon dioxide inside the lungs. Okay, inside the alveolar sac of lungs. So that is known as a minor circulation or pulmonary circulation. यहाँ पे आपको याद रखना है कि मेजर सर्कुलेशन क्या होता है और माइनर सर्कुलेशन क्या होता है. मेजर सर्कुलेशन इज नथिंग बट द exchange of gases within the exchange of gases between blood and cells, tissue, etc. So cells and tissue of your body will exchange the oxygen and carbon dioxide through blood. That is known as a systemic circulation or major circulation. Remember. Then after this, minor circulation means what? Minor circulation means circulation of or exchange of gases between blood and lungs, blood and alveoli of lungs. Now in the systemic circulation, your cells, tissue will take oxygen and will deposit carbon dioxide. Okay, so it will take, cell, tissue, organ will take oxygen and it will excrete the carbon dioxide. That is the systemic circulation. Now in case of pulmonary circulation, what happens? Your lungs or alveoli of lungs will take carbon dioxide and will expire into the air and will exchange with the oxygen. So oxygen is taken up inside the blood in the lungs through a pulmonary circulation, and carbon dioxide is taken off. in the air by the pulmonary circulation. So remember, there are two types of circulation. Systemic circulation is also known as a major circulation. That is the exchange of gases between blood, cells and tissue. Then pulmonary circulation means minor circulation, and that is nothing but the exchange of gases between blood and alveoli lining of lungs. So in the systemic circulation, oxygen is taken oxygen is taken in the cells and carbon dioxide is deposited in the blood. Now in case of pulmonary circulation, carbon dioxide is deposited in the air, and from air oxygen is taken and deposited into blood. Now there is another one more circulation known as a portal circulation. Portal circulation means what? Circulation of blood. Okay, circulation of blood from intestine or GIT area. So whatever blood is, which is a venous blood, that is taken from your GIT area and that is supplied to a liver by means of portal vein or by through a portal vein. तो GIT एरिया जो है आपका आपका जो स्टमक है इंटेस्टाइन है वहाँ पे जितने भी न्यूट्रिशन एब्सॉर्ब हो चुका है जैसे आप जो भी न्यूट्रिशन लेते हो डाइट में तो दैट न्यूट्रिशन इज बीइंग एब्सॉर्ब इन द ब्लड. Now that blood is carried to a liver via portal vein. This circulation is known as a portal circulation. Okay. So remember there are three kinds of circulation: systemic circulation, exchange of gases between blood and cells, tissue, etc. Then pulmonary circulation, that means exchange of gases between blood and alveoli. Okay. Then portal circulation means circulation of blood, circulation of venous blood from GIT area to the liver. That is a portal circulation. Okay. Now you might have seen the first pass effect. We have seen the first pass effect or pre-systemic metabolism in the very first lecture when we were discussing about the general pharmacology. What does it mean? So whatever portal blood is carried, okay, via portal vein, whatever blood or whatever absorbed nutrition along with the drug that is carried to a liver via portal vein, and in the liver there is some part of drug will be metabolized. That is known as a pre-systemic metabolism or first pass effect. We have seen them. Okay? That is due to this portal vein. Whatever absorbed from GIT area, जो आप खाना खाते हो जैसे न्यूट्रिशन लिया आपने जो भी खाना खाया तो वहाँ पे उसमें कार्बोहाइड्रेट प्रोटीन्स लिपिड्स विटामिन मिनरल्स जो भी है वो एब्सॉर्ब होके ब्लड में जाएगा और वो ब्लड कहाँ जाता है लीवर में जाता है थ्रू ए पोर्टल वेन. दैट इज नोन एज अ पोर्टल सर्कुलेशन. So as I told you, I am not going to discuss this chapter in a detail, but whatever is important for your pharmacology, so that's why remember over here your left side of your heart will have oxygenated blood or pure blood, and right side of your heart will have deoxygenated blood. तो हार्ट के लेफ्ट साइड में क्या होता है? लेफ्ट साइड में ऑक्सीजनेटेड ब्लड या फिर आप उसको प्योर ब्लड बोल सकते हो, वो होता है लेफ्ट साइड में. राइट साइड में क्या होता है? डीऑक्सीजनेटेड ब्लड और impure blood also. So your left side of heart consists of oxygenated blood and right side of your heart will have deoxygenated blood. Now this circulatory system consists of different organs. Okay. So as we have seen in the very first lecture of anatomy physiology. So cell, first one is a cell. After the collection of cell for a particular function known as a tissue, and collection of such kind of tissue to perform a particular function known as a organ, and collection of different organ for performing a specific function known as a system. Okay. Now this circulatory is the system. Okay. So it involves different organs like your blood vessels. Okay. So blood vessels like capillaries, then blood vessels. Okay. Then major blood vessels, then your heart. Okay. Lung. So these are the organs of circulatory system. So remember, circulatory system will have different organ like blood vessels. Blood vessels are of two types: arteries and veins. Okay. So arteries and veins, they will also divide into smaller. Artery will divide into smaller arteries known as arterioles. Arterioles will again divide into smaller blood vessels known as capillaries. Okay. So capillaries, arterioles, and then artery, and after that major artery is known as aorta. Likewise that veins are also there. So vein will divide into venules, and venules will divide into capillary. Okay. So you can see over here it is a artery and it is a vein. It is vein. So vein will will become smaller to become a venules. Now this is venule. This artery will become smaller, become a arteriole. Okay. Arterioles. Now arterioles, they will become a smaller to become a capillary, to form a capillary. Venules will form a capillary and they will unite each other. Okay. So at the tissue ending, at the cellular level, at the tissue level or cellular level, at the cellular level. So arteries will supply a oxygenated blood to the tissue and cell, and veins will drain out or will take deoxygenated blood from the tissues. So there is a capillary network mixing. There is a capillary network. There is a mesh like network like mesh, or there is a wave like structure or spider like structure. So made up of a capillaries of your arteries and veins. Now what do you mean by artery? Artery, they are nothing but the blood vessel which consists of oxygenated blood. आर्टरी में क्या होगा, ऑक्सीजनेटेड ब्लड होगा, एंड वेन्स में क्या होगा, डीऑक्सीजनेटेड ब्लड होगा या फिर इनप्योर ब्लड. सो आर्टरीज कंसिस्ट ऑफ ऑक्सीजनेटेड ब्लड एंड वेन्स कंसिस्ट ऑफ डीऑक्सीजनेटेड ब्लड. नाउ आर्टरी का काम क्या है? सो टू कैरी द ऑक्सीजनेटेड ब्लड फ्रॉम योर हार्ट टू द डिफरेंट बॉडी पार्ट्स. आर्टरी का काम क्या होता है? टू कैरी ए ऑक्सीजनेटेड ब्लड, ऑक्सीजन कंटेनिंग ब्लड टू ए डिफरेंट पार्ट ऑफ योर बॉडी. ओके, आर्टरीज. नाउ वेन्स का काम क्या होता है? वेन्स they will carry deoxygenated blood from various part of your body to the heart. Okay, so remember, arteries will carry blood towards the cells, towards the tissue. Arteries will carry blood away from the heart, and towards the tissue. Arteries will carry blood away from the heart and towards the tissue, but veins will carry blood away from the tissues and towards the heart. So remember, veins carry blood towards the heart, artery carries blood towards the different tissues. Remember this. Okay, now we'll see that what is the difference between arteries and vein. They might ask you a question on this: what is the difference between arteries and veins? So remember, arteries are the blood vessel having thick wall. So इनका जो muscular layer होता है, that is a thick wall, वो थोड़ा सा बड़ा होता है. And veins जो है, that they are the blood vessel containing thin wall of muscular layer. So arteries are having thick wall, veins are having thin wall. Okay. Now these blood vessels are made up of different layers of the layers of the layers of the tissue. These arteries and veins are made up of different layers. So first outer layer is known as tunica externa. Tunica externa. Okay, so that is the outer layer. Now this outer layer is made up of a collagen fiber and collagen fiber. Fibrous layer is a fibrous layer. Collagen protein से बनता है ये fibrous layer. Okay, outer layer of arteries or vein known as a tunica externa. After that, middle layer is known as a tunica media. Middle layer is known as a tunica media, which is made up of a smooth muscles. Remember, which is made up of a smooth muscle and elastic fiber. So because this middle layer of arteries and veins is made up of smooth muscles and it can contract and relax. So it can contract and relax. It can contract and relax. So that's why arteries and veins will have elasticity. Arteries and veins will have elasticity. Remember, because of that middle layer. Okay, muscular middle layer. So outer fibrous layer, middle muscular layer, and inner layer is again made up of epithelium. Inner layer is again made up of epithelium, and inner layer is known as a tunica intima. So these are nothing but the structural organization of the veins and arteries. Okay, so remember, there are three kind of layers in the arteries and veins. So outer layer is known as a tunica externa, which is made up of collagen fibers. Both arteries and veins will have outermost layer known as a tunica externa, made up of collagen fiber. Basically, this layer, the function of this layer is to support, to give a mechanical support. Now again, second layer is known as a muscular layer. It is nothing but the tunica media. And in this layer, you have muscular layer. Okay, tunica media. Smooth muscles are there, and elastic fibers are there. Elastic fibers means they are stretchable. कम ज़्यादा size हो सकता है उनका. Because of the muscle and elastic fiber, this artery can constrict and can relax. Now this muscular layer is supplied with the various nervous control. Like sympathetic nerves are control. Sympathetic nerve fibers are there. Parasympathetic fibers are also there. Okay. Now the smooth muscles of these blood vessels, they are supplied with the nervous innervation or nerves of sympathetic origin and nerve of parasympathetic origin. Okay, that's why these system can control the caliber. Caliber means internal diameter of your blood vessel. Okay. Now innermost layer of this blood vessel is known as a tunica intima. Tunica intima is the innermost layer. Outermost layer कौन सा होता है? Tunica externa. Remember. Now innermost layer is a tunica intima and it is made up of endothelium and subendothelial layer. Okay. So internal elastic membrane is there in case of this. Okay. Now another difference is there in case of artery and vein. So artery will not have arteries will not have any kind of valves in their structure, but these veins will have valves to prevent the backflow. veins में क्या होता है? valve होता है. arteries में valve नहीं होता. valve मतलब क्या है? valve मतलब कप साइज कप दे आर नथिंग बट valve मतलब थोड़ा सा ऐसा V shaped ये होता है that will prevent the backflow of blood. Okay, in the veins. veins में semilunar valve होता है. remember there are semilunar valves present in the veins, but they are absent in the arteries. And remember, artery carries the blood with the highest pressure. So whatever blood is in the artery, they are having blood with the pressure. veins में blood pressure से नहीं आता, veins में कम आता है. And arteries में blood flow pulsatile होता है, veins में smooth flow होता है. So remember, there is a pulsatile flow in the artery and there is a smooth flow in the vein. We'll see the difference between arteries and vein again. So I have already told you the difference, but still again we'll see. So first, arteries. So artery will carry oxygenated blood and that is away from the heart. Okay, so arteries will carry oxygenated blood away from the heart, but there is a one exception. So this pulmonary artery is an exception. So normally artery क्या है कि artery में oxygenated blood होता है और away from the heart carry करता है. So artery normally oxygenated blood carry करता है, but pulmonary artery is an exception. It will carry deoxygenated blood. Pulmonary artery will carry deoxygenated blood. Okay, and these artery usually carries the blood with high pressure. So artery carry oxygenated blood away from the heart with the high pressure. Exception क्या है? Pulmonary artery. Now arteries are a thick wall. So इनका जो wall होता है arteries में, जो muscular layer होता है, so वो क्या है? थोड़ा सा thick होता है. So they are thick walled and deeply seated. Deeply मतलब सुपर सरफेस पे नहीं होंगे, ये deep होंगे. Deep inside the deep below the skin. So on the surface veins are there. Okay, so they are deeply seated and valves are absent in the arteries. Valves are absent in the arteries. And arteries will have pulse flow. So remember this difference is very important. They can ask a question on this. Now veins carry deoxygenated blood towards the heart. Okay, and it is at low pressure. Okay, low pressure. Exception क्या है यहाँ पे? Arteries. Okay, normally veins will carry deoxygenated blood, but this pulmonary vein carries oxygenated blood. ये क्यों होता है? क्यों ये कैरी करते हैं? So remember, arteries carry oxygenated blood except pulmonary artery, and veins carries deoxygenated blood except pulmonary veins. Okay, but veins में pressure क्या होता है? कम होता है. They carries the blood towards the heart with a low pressure. Arteries carries the blood away from the heart with high pressure. Okay, so remember, arteries are the thick walled and veins are the thin walled and they are subcutaneously seated. मतलब veins क्या होंगे? थोड़े से superficially आपको मिल जाएंगे. जैसे आपका wrist भी आपने inverted wrist किया तो आपको एक vein दिखाई देगा. But artery क्या होता है? artery नीचे होता है, उसके नीचे. So deeply seated होता है. veins superficially होता है. Now valves are present in the and veins में क्या होता है? smooth flow होता है, smooth flow. So if you cut the artery and if you cut the vein, so in case of artery there is a pulsatile flow. मतलब जैसे हार्ट बीट होता है आपका, तो उस टाइप से फ्लो आता है उसका. जैसे सिस्टोल होगा तो ज्यादा ब्लड फ्लो, डायस्टोल में कम होता है. In case of vein there is a smooth flow. Vein doesn't need, it will have a smooth flow. Now what is blood vessel diameter is controlled by vasomotor center arising. Okay, so nerves arising from, and these nerves are innervated by autonomic nervous system. So the blood vessel diameter is controlled by vasomotor center. Remember, so blood vessel का diameter relax करना है, constrict करना है, blood vessel कौन control करता है? vasomotor center. So vasomotor center means, so this is the center in the medulla oblongata. Okay, medulla. So they are innervated with, means they are supplied with autonomic nervous system nerve like sympathetic nervous system nerve and parasympathetic nervous system nerve. Release of metabolic waste like carbon dioxide and lactic acid. Metabolic waste is carbon dioxide and lactic acid. So release of metabolic waste, carbon dioxide and lactic acid increases the blood into tissue area. So particular tissue में blood flow कब increase होगा, जब वहाँ पे उस area में carbon dioxide ज़्यादा होगा या lactic acid ज़्यादा. Now hypoxia means decreased oxygen. Okay, hypoxia means decreased oxygen. So if hypoxia is there, again it will stimulate the vasodilation and increases the blood flow in the affected area. Okay, suppose that if your particular tissue or cell are having hypoxia, so at that cell or tissue the blood circulation will be increased. Okay, so hypoxia stimulates the vasodilation and increases the blood flow. Again, temperature also result in the vasodilation. So increased temperature result in the vasodilation and increase the blood flow. Remember this. Now blood supply to a skeletal muscle will increase around 20 times more during the heavy exercise. So जब आप एक्सरसाइज करते हो तो नॉर्मली आपके स्केलेटल मसल को ब्लड सप्लाई कम होता है. अगर आप रेस्ट में हो, अगर आप कुछ काम नहीं कर रहे हो, रेस्ट कर रहे हो, तो ब्लड सप्लाई स्केलेटल मसल को कम होता है ड्यूरिंग एक्सरसाइज. तो स्केलेटल मसल का ब्लड सप्लाई बढ़ जाता है 24 times. So blood supply to skeletal muscle will increase as much as 24 times during the heavy exercise. Exchange of gases in the tissue takes place by diffusion. Now you will ask, so how cell will take oxygen and will release the carbon dioxide in the blood? So that is by diffusion. Okay, against the concentration gradient. Diffusion occurs with the concentration gradient. So if in the one compartment oxygen is more and in the another compartment oxygen is less, then oxygen will move from more concentration to a lower concentration. That is a diffusion. So if your cells are having less oxygen, then that they will take oxygen from blood is having less carbon dioxide, so cells will deposit the carbon dioxide over there. Now we'll see the structure of heart. So heart is nothing but the main organ for your circulatory system. Okay, so it is nothing but the pump. It will pump the blood throughout the body and it will also collect the blood from your body. So it's acting as a double pump. So heart is a nothing but the double pump. दो बार एक बार पंप करता है ब्लड अवे बॉडी के लिए और वो उसी उसी पंपिंग में कलेक्ट भी करता है ब्लड. So it is acting as a double pump. So what is the normal weight of heart? It is a 225 gram in the woman and 310 gram in the men. तो इसका मतलब ये है कि मेंस में हार्ट का वेट जो है वो ज़्यादा होता है, वुमेन्स में कम होता है. ओके, इसका मतलब ये नहीं कि जो मर्द होता है उनका दिल बहुत ही कठोर होता है. ठीक है. सो अगेन heart is nothing but the hollow muscular organ that pumps the blood throughout the body. Okay, now its normal weight is 225 gram in a woman and in the man it will have 310 gram. It is the average weight. It can vary. ऐसा नहीं कि इसका मतलब ये नहीं कि आपका हार्ट का वेट उतना ही होना चाहिए. वुमेन्स में 225 मतलब आपका 228 हो गया तो आप एबनॉर्मल हो, ऐसा नहीं. सो इट इज एवरेज. इट इज कैलकुलेटेड यूजिंग, जैसे एक 100 पीपल का सर्वे किया जाता है, 100 लोगों का सर्वे किया जाता है. जैसे 100 लोग देख लिए, 100 लोगों में हार्ट, जैसे आपके पास में 100 बॉडीज है, उसका हार्ट निकालो, उसका वेट करो. 100 बॉडीज का हार्ट का वेट अगर एवरेज कितना आता है, दैट एवरेज इज टेकन एज अ नॉर्मल वैल्यू. सो नॉर्मल वेट इज नथिंग बट द एवरेज. ओके, सो उससे कम ज़्यादा हो सकता है. सो नॉर्मल वेट is 225 in the woman and 310 in the man. Now your heart is covered by heart consists of three layers. Your heart is having three layers of muscles. Okay, so outer layer is known as a pericardium. Outer layer is known as a pericardium. Middle layer is known as a myocardium and inner layer is known as endocardium. So your heart is made up of three layers of tissue. ठीक है, आपके हार्ट में 3 layers होते हैं टिश्यू. So outermost layer is known as a pericardium. Pericardium. It is the outermost layer and it will protect the heart from over distension. Okay, over distension मतलब जब कॉन्ट्रैक्ट होगा हार्ट और रिलैक्स होगा, तो रिलैक्स इतना भी रिलैक्स नहीं होना चाहिए कि बाहर जाए, उसके पेरी पेरी में रहना चाहिए. So this pericardium is also made up of two sublayer. Okay, it is also made up of two sublayer. So outer pericardial layer and visceral pericardial layer. Okay, so in between these two pericardial layer, so there is a small gap. Okay, and in that gap there is a one fluid known as a pericardial fluid. that will act as a lubricant for heart. Remember, in between the two layers of pericardium, so there is a certain cells of pericardium which secretes a fluid. Okay, so pericardial fluid, known as a pericardial fluid. So as I have told you, pericardium is again having two layers: outer pericardium and inner pericardium. Outer pericardium and inner means visceral pericardium. In between that there is a tiny gap, there is a very small gap. That gap is filled with this pericardial fluid which is secreted by serous membrane of your pericardium. Serous membrane of your pericardium, normally it is around 25 to 30 ml serous fluid. Okay, so this secreted by serous membrane which is the inner layer of pericardium, and outer layer of pericardium is nothing but the outer layer of pericardium is nothing but the fibrous pericardium. Okay, so outermost layer of heart is pericardium. It is again made up of two layers. Okay, so outer fibrous pericardium and inner serous pericardium. In between these two layers, so there is a small tiny gap. In that gap there is a pericardial fluid secreted by serous membrane of the pericardium. Now middle layer of your heart is nothing but the myocardium. Myo means muscle and cardium matlab heart. So myocardium, cardiac muscles. Okay, so myo means muscle. Okay, myo means muscle and cardium matlab heart. So myocardium is nothing but the second layer of your heart, which is a muscular layer, and it is not under voluntary control. They say it is under involuntary control. It is not under voluntary control, it is under involuntary control. Means you cannot control your heartbeat. आप ऐसे नहीं बोल सकते कि आपके लिए ही मेरा दिल धड़कता है, तो आप नहीं हो तो मेरा दिल नहीं धड़कता, क्या बंद होता है क्या? नहीं. So you cannot stop your heartbeat. So it is under involuntary control. Okay. Now this myocardium is made up of a specialized cardiac muscle cell. So it is made up of a specialized cardiac muscle cell. Okay, known as a myocardial muscle, or okay, known as a known as a myocytes. Myocytes. Okay, it is made up of a specialized cardiac muscle known as a myocytes. Okay, and it is a muscular layer, and it is a very thick in case of left ventricle. लेफ्ट वेंट्रिकल में ये मस्कुलर लेयर ज़्यादा रहता है, because left ventricle has to supply the blood throughout the body. Now again we'll see the muscle, what kind of cardiac muscle is there in the upcoming slide. Remember over here, a specialized muscle cell in the wall of arteries. A specialized muscle cell in the wall of arteries, specialized muscle cell in the wall of arteria will secrete natriuretic peptide. Natriuretic peptide, ANP means atrial natriuretic peptide. So मायोकार्डियम में जो मस्कुलर लेयर होता है उसमें एक जो एट्रियम होता है या फिर ऑरिकल होता है, तो उसका जो मस्कुलर लेयर है वो एक पेप्टाइड सिक्रीट करता है, उसको बोलते हैं natriuretic peptide और atrial natriuretic peptide. One and the same. Okay, now this is very important peptide. Okay, this is very important peptide. इसका काम क्या है वो बाद में आपको जब ड्रग एक्टिंग ऑन कार्डियोवास्कुलर सिस्टम करें अपन तब पता चलेगा. Inner layer of your heart is nothing but the endocardium. Inner layer of your heart is endocardium. Okay, I'm not going in the detail. Whatever is important, I have listed over here. Now, next one is remember there are two veins. Largest vein is superior and inferior vena cava. Largest vein in the body, that is superior and inferior vena cava. What is the largest artery? So largest artery in the body is nothing but the aorta. Aorta is the largest artery. Remember यार, यहाँ पे लिस्ट नहीं किया है मैंने, बोला नहीं है, लिखा नहीं है अपन. लार्जेस्ट वेन क्या होता है? सुपेरियर एंड इंफीरियर वेना कवा. एंड लार्जेस्ट आर्टरी क्या होता है? aorta. Remember, aorta is the largest artery. Now next one is SA node. SA node, or it is known as a sinoatrial node. Sinoatrial node, SA node or sinoatrial node. It is nothing but the pacemaker of the heart. So whatever impulse is generated, that is generated by pacemaker. So your heart is beating around 72 beats per minute. Okay? So that beats per minute, that is upon the SA node. So SA node will generate impulse, and that impulse will be transmitted throughout the heart, and then only your heart muscle will contract. So SA node is known as a pacemaker of heart, and it will generate impulse at a 60 to 80 times per minute. Remember, pacemaker of your heart is SA node. Then there is another node known as AV node. Okay, AV node means atrioventricular node. Atrioventricular node. So it is again having capacity to generate a impulse. So okay. So SA node generates a impulse at a slower rate, that is 40 to 60 beats per minute. Okay. So SA node जो है that will generate around 60 to 80 beats per minute. Okay. And AB node will generate at a 40 to 60 impulse per minute. Now vagus nerve is supplemented to AC node and AB node. Vagus nerve मतलब क्या? It is a nerve of cholinergic, so acetylcholine containing nerve. It is supplemented to AV node and SA node. Okay, stimulation of this result in the decrease in the heart rate and force of contraction. So vagal stimulation will be the term you will came across lot of time. आपको ये बहुत बार आएगा कि vagal stimulation will decrease the heart rate because vagus nerve consists of a cholinergic nerve and it consists of a acetylcholine that will decrease the heart rate and force of contraction of myocardium. So vagal stimulation will decrease the automaticity and myocardial contractility. Okay, so SA node is known as a pacemaker. AV node is not. AV node is also there. Okay, AV node is in secondary one. So main function of impulse generation is of SA node, and impulse conduction is done by AV node and Purkinje fiber and all that. So there is one specialty of your कार्डियक मसल और कार्डियक सेल्स. जो आपके मसल सेल होते हैं या फिर बाकी के सेल होते हैं उसमें ये नहीं रहता कि दे विल नॉट हैव capacity to generate an impulse, but your cardiac cells or cardiac muscle cell will have capacity to generate a impulse, electrical activity. Okay, electrical impulse, so that is generated by your heart cardiac cells. Okay, cardiac cells में impulse generate होता है and it is the specialty of your cardiac cell. So cardiac cell में ही आप impulse generate होता है आपके, बाकी के सेल में impulse generate नहीं होता. Okay, and most of the impulse okay, and SA node is nothing but the collection of such specialized cell. They are involved in the generation of impulse, and AV node it will also generate and it will transmit the impulse so that then heart will contract and relax. Now cardiac cycle is very important. इसके ऊपर क्वेश्चन आ चुके हैं बहुत बार. So cardiac cycle is nothing but the one cardiac cycle means what? Contraction of heart and relaxation of heart. So whatever the event between one contraction of your contraction of your heart and relaxation of your heart, so that events, whatever events are there in the one cycle of contraction and relaxation of heart is known as a cardiac cycle, and it is a 0.8 second. 0.8 सेकंड में आपका हार्ट आपका एक बार कॉन्ट्रैक्ट होके रिलैक्स हो जाएगा. 0.8 सेकंड. नाउ दिस इज डिवाइडेड इनटू सब टाइप्स. सो इन दिस आर्टेरियल सिस्टोल मतलब आर्टेरिया का कॉन्ट्रैक्शन कितने टाइम पे होगा? 0.1 सेकंड में. सो आर्टेरियल सिस्टोल इज 0.1 सेकंड, वेंट्रिकुलर सिस्टोल इज 0.3 सेकंड एंड कंप्लीट कार्डियक डायस्टोल. ठीक है, जैसे एट्रियम है आपका, एट्रियम या फिर ऑरिकल्स विल कॉन्ट्रैक्ट फॉर 0.1 सेकंड. ओके, ventricles will contract for 0.3 second and complete cardiac diastole मतलब ventricle plus systole, ventricle plus atrium, they will diastole मतलब they will relax. So systole means contraction, diastole मतलब relaxation. Okay, so atrial systole means atrium contraction, ventricular systole means ventricular contraction, and ventricular diastole means ventricular relaxation. Okay, complete cardiac diastole 0.5 second, 0.4 second. So remember the cardiac cycle is of 0.8 second. Out of that, ventricular systole is of 0.1 second. Atrial systole is of 0.1 second. Ventricular systole is of 0.3 second. Complete cardiac diastole is of 0.4 second. इसके ऊपर GPAT में क्वेश्चन आ चुका है, GPAT 2019. ECG. So ECG means electrocardiogram. So recording of electrical activity present in your heart. That is nothing but the electrocardiogram. So if you record ECG, आपने देखा होगा ECG तो PQRST वेव आता है उसमें, PQRST. Okay, it comprising of PQRST wave. Now P wave is because of the impulse that arises from SA node. P wave is because of the impulse arising from SA node and that denotes the atrial depolarization or atrial contraction. Then QRS complex, that is because of the rapid spread of impulse from AV node to the another part of your heart, bundle of His and Purkinje fiber, that is due to depolarization, that is contraction of your ventricles. Then QRS complex. Then T wave is because of the ventricular repolarization, that is meant by, that is nothing but the ventricular relaxation. Okay, so this is the cardiac cycle and ECG. Now you can see here cardiac cycle again. So whatever the red area is there, so red area is nothing but the systole, means contraction, and this blue area is nothing but the diastole, that means relaxation. Now this atrial systole, okay, atrial systole or auricular systole is of 0.1 second. Atrial systole is of 0.1 second. Then this ventricular systole is of, okay, ventricular systole is of 0.4 second. Ventricular systole is of 0.4 second. Atrial systole 0.1 second. Ventricular systole 0.1 second. मतलब एट्रियम और ऑरिकल्स आपके कॉन्ट्रैक्ट होंगे 0.1 सेकंड के लिए. उसके बाद में वेंट्रिकल्स कॉन्ट्रैक्ट होंगे 0.4 सेकंड के लिए. ठीक है. नाउ रिमेनिंग 0.4 सेकंड, दैट इज नथिंग बट द डायस्टोल. ओके, दैट इज नथिंग बट द डायस्टोल. सो एट्रियल डायस्टोल कितने सेकंड का है देखो. वेंट्रिकुलर डायस्टोल 0.4 सेकंड का. सो एट्रियल डायस्टोल, ठीक है, एंड वेंट्रिकुलर डायस्टोल और कंप्लीट कार्डियक डायस्टोल दैट इज ऑफ 0.4 सेकंड. सो कार्डियक साइकिल मींस, so whatever the events that comes in the heart in the one cycle of contraction and relaxation, that is nothing but the cardiac cycle. Remember, ये इसके बारे में क्वेश्चन पूछा है जीपैट में कि वेंट्रिकुलर सिस्टोल कितना टाइम का होता है, कंप्लीट डायस्टोल कितना टाइम का होता है, कार्डियक एट्रियल सिस्टोल कितने टाइम का होता है. ठीक है, दैट इज अ कार्डियक साइकिल. नाउ इट इज द स्ट्रक्चर ऑफ योर हार्ट. So you can see over here. So first one is nothing but this large blood vessels. They are known as veins. Yellow colored blood vessels, they are known as veins because they will carry deoxygenated blood. Now this is a superior vena cava. Okay, this one is a superior vena cava and this one is the inferior vena cava. Inferior vena cava will collect the deoxygenated blood from lower part of your body below the your truncal area. Now superior vena cava will collect the deoxygenated blood from upper part of your body like limbs, head, etc., etc., limb, thoracic, head, and etc. Okay, so that will collect the deoxygenated blood from upper part, superior vena cava. Inferior vena cava will collect the deoxygenated blood from lower part, and both these veins will drain their blood in the right atrium, right atrium. Okay, यहाँ पे ब्लड लाके छोड़ देगा राइट एट्रियम. ओके, सो बोथ दिस veins, superior vena cava, inferior vena cava, will collect the blood from various body parts and they will drain the blood in the right atrium. Now after this, right from the blood from right atrium will enter into right ventricle. This is known as a right ventricle, and from right ventricle blood will be pumped into the pulmonary vein. This is known as a pulmonary vein, left and right branch of pulmonary vein. Now this pulmonary vein will carry this deoxygenated blood to the lungs where there will be exchange of carbon dioxide and oxygen and there will be purification of blood. Now this is a pulmonary artery. So this impure blood will be pumped into pulmonary artery and it will be sent to lungs. Okay, left pulmonary artery and right pulmonary artery. Left pulmonary artery and this one is a right pulmonary artery. So the impure blood will be pumped to lungs. There will be exchange of gases. Blood will be purified over in the lungs and lungs will carry purified blood into the heart via right pulmonary vein and left pulmonary vein. From the lungs, after exchange of gases, the blood will come and it will be deposited in this area, left atrium. So pure blood will be there in the left atrium. From this left atrium, blood will travel to the left ventricle, and from this left ventricle, blood will be pumped into the aorta, and aorta will supply the blood to a different body parts. So that's how there is a movement of blood within the heart. So you have to understand how there is a flow of blood in the heart. Movement of blood within the heart. Now remember over here. So heart is also a organ. It is also made up of a different kind of cells, tissue. So it also needs nutrient. So your right part of your heart is supplied with the pure blood via this known as a right coronary artery. So right coronary artery will supply blood to a heart itself, right side of heart. Then this left coronary artery will supply a blood to a left part of your heart. And right pulmonary vein and left pulmonary vein, they will drain blood respectively from the that part. Okay. Now occlusion or any blockage of this right or left coronary artery, अगर coronary artery का कोई block हो गया है तो उसको बोलेंगे most of the blockage जो होता है that is in the coronary artery, because coronary artery is a very it is a very narrow, it is a very narrow artery, and most of the time this blockage result in the myocardial ischemia, myocardial ischemia, myocardial infarction, myocardial ischemia, angina pectoris. So most of the heart disease they are because of the inadequate supply of blood to the heart or disturbed supply of blood to the heart due to blockage of this coronary artery. ठीक है, blockage may be due to different reason. If there is a any clot formation, that will also be result in the blockage. If there is a fatty deposition in the coronary artery, that is known as arteriosclerosis. Fatty deposition in the coronary artery known as a arteriosclerosis. Okay, so remember these are the parts of your heart, right? अभी और एक बार मैं दिखाता हूँ आपको. This part is known as a right atrium. This part is known as the right atrium. Okay, this part is known as right atrium, and this part is known as the right ventricle. So impure blood is present in the right part of your body, right part of your heart. Impure blood. Okay, this part is known as the left ventricle. This part is known as a left auricle, and this part is known as the left ventricle. So this part जो is known as a left auricle. Okay, left auricle or left atrium, and this will carry blood, this will transfer blood to left ventricle. So now we'll see the next. Again you can see over here in a simplified diagram the how there is a flow of blood in the heart. Okay, so this superior vena cava or superior vena cava and inferior vena cava, they will carry a deoxygenated blood into the this right atrium. From the right atrium blood will move to the right ventricle. Now here atrioventricular valve is there. Atrioventricular valve or tricuspid valve is there. Valve means this structure. Okay, this structure. Okay, this structure will prevent the backflow of blood. कि एक बार एट्रियम से ब्लड वेंट्रिकल में आ गया तो वेंट्रिकल से फिर से एट्रियम में ब्लड ना जाए, इसके लिए क्या है यहाँ पे वाल्व है, गेट है, गेट. Okay, now this gate present between right atrium and right ventricle is known as a tricuspid valve or atrioventricular valve. Okay, tricuspid valve or atrioventricular valve. Okay, so it is known as a tricuspid valve or atrioventricular valve. You can see over it. This tricuspid valve will prevent the backflow of blood from right ventricle to right auricle. ठीक है, तो कहाँ पे क्या होता है याद रखोगे. So this tricuspid valve, what is the function of tricuspid valve? So it will prevent the backflow of blood from right ventricle to right auricle. Okay, that will prevent the backflow. Tricuspid valve, because there are three cusps or there are three cups or there are three. That is known as tricuspid valve. Now, after entering a blood through vena cava into right atrium, it will travel to right ventricle, and from right ventricle, this blood will be pumped into this pulmonary veins. Okay? Pulmonary veins, ये जो blue color का pulmonary vein है, so in the pulmonary veins this blood will be pumped. This will go to the left lung and right lung respectively. There will be purification of blood, and left lung and from right lung purified blood will be sent to this atrium known as a left atrium. Left atrium via pulmonary veins. Now from left atrium blood will travel to left ventricle. Okay? To prevent the backflow of blood from left ventricle to right auricle, so there is another valve or gate known as a bicuspid valve. Known as a bicuspid valve. So remember, from the lungs purified blood will be drained into this left atrium. Okay, left atrium by pulmonary veins. From left atrium blood will go into ventricles, left ventricle, and to prevent the backflow of blood into to prevent the backflow of blood from left ventricle to left auricle, there is a bicuspid valve. There is a bicuspid valve. Bicuspid valve है वहाँ पे. And from left ventricle blood will be pumped into this aorta. That is a red color aorta. That is and this aorta will supply blood to body, whole body. Okay, that's how there is a flow of blood in the heart. Okay, you can see over here. So left atrium जो है, it is a thinner than लेफ्ट वेंट्रिकल. सो वेंट्रिकल्स का वॉल जो है, देखो यहाँ पे मस्कुलर लेयर जो है वो वेंट्रिकल्स में ज्यादा है एज कम्पेयर टू ऑरिकल्स. सो इन केस ऑफ राइट atrium, the muscular wall of the right atrium is thin than right ventricle. As like that, left auricle will also have thin wall. So we was discussing about how there is a flow of blood within the heart. Okay, so as I have already told you, there is a little bit difference between your cardiac muscles and your skeletal muscles. जो आपका skeletal muscle है और cardiac muscle में difference होता है. Okay, so in case of cardiac muscle, they are self exciting. Remember, cardiac muscle or cardiac muscle cells, they are self exciting, and there is a presence of intercalated disc between two cells of cardiac cell. Okay, so two cells of cardiac muscle, they are connected by intercalated disc. Okay, now this cardiac cell muscle cell will have nucleus, and these muscle cells are interconnected, and because of that, a single cell stimulation, if there is stimulus to one cell, so this stimulus will be transmitted to neighboring cells, and there will be complete cardiac excitation. So that is the main difference, that cardiac muscle cell, they are made or they are organized in such a manner that a single stimulus to one cell will stimulate the entire cardiac muscular system, entire cardiac myocardium. Now we'll see here again anatomy of heart. So we have seen already, but I will repeat it. So your heart is made up of a three different layer. Outermost layer is known as the pericardium. So pericardium is also again consist of two layers. Okay, so that is a parietal pericardium and visceral pericardium. Parietal means outer pericardium and visceral means inner. So visceral pericardium is made up of a serous membrane, and it will secrete a one fluid in between these two known as a pericardial fluid. Okay, now myocardium is nothing but the muscular layer of your heart, and it will form. Okay, this muscular layer will be in the all four chambers. Okay, muscular layers of heart and the wall of four chambers, they are made up of this muscle, myocardium, and it is known as a heart muscle. Okay, now endocardium is nothing but the inner layer, which is made up of endothelial lines. They are smooth to prevent the abnormal clotting. Endocardium is very smooth, and if there is a rough surface in the cardiac muscle or cardiac inner layer, there will be clotting of blood. Okay, so that's why endocardium is very smooth. It is made up by endothelium lines, which are very smooth, so to prevent the any blood clotting in the heart. Now right atrium will receive deoxygenated blood. Right atrium में क्या होगा, impure blood आ जाएगा. It will receive impure blood from superior and inferior vena cava. Okay, then right atrium will transfer the blood to right ventricle. Okay, from right atrium blood will go to right ventricle, and in between these two there is a tricuspid wall. So it is also known as an atrioventricular wall, and this will prevent the backflow of blood from right ventricle to right auricle when ventricles contract. Right ventricle pumps the blood into pulmonary veins, pulmonary artery. Right ventricle will pump the blood to the pulmonary artery, and that arteries will carry this deoxygenated blood into lung. There will be purification, there will be exchange of carbon dioxide and oxygen, and they will transfer the pure blood into pulmonary veins, and that will drain into your left atrium. Okay, now to prevent the backflow of blood from right ventricle to the sorry to prevent the backflow of blood from pulmonary artery to the right ventricle, there is a pulmonary semilunar valve. Okay, now let's come to the left atrium. So left atrium or left auricle will receive oxygenated blood from the pulmonary veins, and from the left atrium blood will be transferred to left ventricle, and in between that left atrium and left ventricle there is a mitral valve. The mitral valve, okay, mitral valve, or it is also known as a bicuspid valve. It is also known as a bicuspid valve, which will prevent the backflow of blood from left ventricle. From it will prevent the backflow of blood from left ventricle to left auricle. when left ventricle will contract. Now left ventricle which will pump the blood to whole body. Now aortic semilunar valve. So left ventricle will pump the blood through aorta all over the body to prevent the backflow of blood from aorta to the left ventricle. Aortic semilunar valve is there. Fibrous skeleton present in the heart. So whatever valves we are talking, जो valves होते, so they are nothing but the fibrous skeleton present in the heart to prevent the backflow of blood. So anchoring the four heart valve, okay, enlargement of valve opening is electrically monitored in the heart. So this is how anatomy of heart. What is heart sound? Okay, so there are two sounds in the heart, lub and dub. Okay, so lub is due to lub sound is loud and it is due to the closure of atrioventricular valve. जो लब साउंड होता है that is due to the atrioventricular valve closure and it is loud. Dub sound is a little bit softer than lub and it is due to closure of aortic and pulmonary semilunar valve. जो लब साउंड होता है, जो बड़ा वाला साउंड होता है, दैट इज ड्यू टू क्लोजर ऑफ एट्रियोवेंट्रिकुलर वाल्व. ठीक है, मिट्रल वाल्व है, एट्रियोवेंट्रिकुलर वाल्व. तो जो भी दोनों वाल्व है जो वेंट्रिकल्स एंड एट्रिया को कनेक्ट करते हैं, वो वाल्व का क्लोजर होने के बाद लब साउंड होता है, वो बड़ा वाला साउंड है. डब साउंड जो वीक साउंड होता है, दैट इज ड्यू टू द क्लोजर ऑफ aortic and pulmonary semilunar valve. हार्ट रेट इज व्हाट? नॉर्मल हार्ट रेट कितना होता है आपका? Normal heart rate 60 to 80 beats per minute. Okay. So normally your heart will beat around 60 to 80 beats per minute. So normally it is nothing but 72 beats per minute. अपन normal कितना लेते हैं उसका? Average 72 beats per minute. And see, 72 beats per minute is not a actual value. It is an average value. So it can change depending on the situation. So if you are doing rest, at that time your heart will beat less than 70 beats per minute. So if you are running, at that time your heart will beat more than 72 beats per minute. So it depends on the situation. Okay. Again, remember this heart rate is nothing but the average heart rate of many subjects. It is the average heart rate of many subjects. It is not a standard. ये कम ज़्यादा हो सकता है. It may be plus or minus. Now it normally 60 to 80 beats per minute. These heartbeats are generated by SN nodes. So impulse is generated by SN nodes. Number of impulse per minute. So that will decide the heart rate. Okay. So impulse are generated by SN node and propagated through conducting pathway like your Purkinje fibers and etc. Atrial septum etc. Heartbeats normally 72 beats per minute. Abnormal heartbeat or abnormal heart rate is known as a cardiac arrhythmia. Abnormal heart rate is known as a cardiac arrhythmia. So if heart rate is more than normal, then that is known as a tachycardia. If heart rate is less than normal, that is known as a bradycardia. Okay, so bradycardia or tachycardia both are nothing but the arrhythmia. Okay, so rhythm क्या है heart का? What is the normal rhythm of heart? So it should be ideally 72 beats per minute. So if there is disturbance in the rhythm, that is known as arrhythmia. Okay, that is known as cardiac arrhythmia. Now what do you mean by cardiac output? Okay, there was a question in GPAT 2019 regarding this. So cardiac output is nothing but the stroke volume into heart rate. Stroke volume into heart rate, that will give you cardiac output. So ml of blood that is pumped through a heart per minute, that is known as a cardiac output. Okay, so heart normal, okay, cardiac output is given by stroke volume into heart rate. Normal stroke volume is around 70 ml approximately and heart rate is around 70 beats per minute. Normal, what is normal range or normal range of cardiac output? That is a 5 to 6 liter per minute. So normally 5 to 6 liter blood that is being pumped out per minute through heart. So that is cardiac output. So remember, cardiac output is equal to stroke volume into heart rate. And this was question in GPAT 2019. So normally cardiac output is equal to 70 ml into 70 beats per minute. That is around 4900. That is approximately 5 liter. Okay. Normal stroke volume होता है 70 ml and heartbeat होता है around 70. Now what is meant by stroke volume? Stroke volume is equal to cardiac output divided by number of pulse. So cardiac output is around 5 liter divided by number of pulse is around 50. So 100 ml. So stroke volume is around 100 ml. Okay. Due to exercise, stroke volume increases as the venous return increases and stretches the myocardium ventricle, known as a Stirling's law. So normally, if you are sitting, if you are relaxing, at that time your cardiac output will be less. When you are working out, at that time heart rate, at that time cardiac output will be more. So due to exercise, stroke volume increases as the venous return increases and stretches the myocardium of the ventricle, known as a Starling's law. This law is again very important. You have to remember this. तो नॉर्मली आप रिलैक्स बैठे हो तो वहाँ उस टाइम पे कार्डियक आउटपुट आपका कम होगा. जब एक्सरसाइज कर रहे हो तो उस टाइम पे कार्डियक आउटपुट ज्यादा होगा ड्यू टू increased venous return. This is known as a Starling's law. Okay. What is meant by ejection fraction? No class will take all the details. What do you mean by ejection fraction or cardiac reserve? So normally ejection fraction is around 70 to 60 to 70%. Normal ejection fraction is around 60 to 70%. Remember, it was a question again in GPAT and various exams. That is the percentage of blood within the ventricle that is pumped out per bit. So that is the ejection fraction. So this ejection fraction is decreased in case of congestive cardiac failure. क्या होता है कि congestive cardiac failure जो होता है CHF, congestive cardiac failure or congestive heart failure. So in the case of congestive heart failure, this ejection fraction decreases. So if ejection fraction is less than 40%, if ejection fraction is less than 40%, that means you are suffering from congestive cardiac failure. Remember, this is the basis. Normal cardiac reserve is around 50 liter or more. Difference between resting cardiac output and maximum output during exercise. So normal cardiac reserve कितना होता है 15 liters और उससे ज़्यादा भी हो सकता है. And that is nothing but the difference between resting cardiac output and maximum work cardiac output during exercise. So that is okay. Now we'll see the next one. What is meant by stroke volume? Okay, so it is measured or it is determined by amount of blood in the ventricle before they contracts. So number of ml of blood that is present in the ventricle before its contraction, that is nothing but the stroke volume. Okay, and it is also known as a ventricular end diastolic volume. Remember, stroke volume is nothing but the volume of blood that is present in the ventricles before it contracts. That is known as a stroke volume, and it is also known as a ventricular end diastolic volume, or it is also known as a preload. Okay. Now, what do you mean by arterial pressure? Arterial pressure is nothing but the pressure exerted by the volume of blood on the wall of atria. That is the arterial pressure. So it will also affect the stroke volume. It will create the resistance to blood being pumped. Next one is blood pressure. What do you mean by blood pressure? So pressure exerted by blood on the wall of artery. That is nothing but the blood pressure. Now blood pressure is equal to cardiac output into peripheral resistance. So this formula you have to remember. This formula is very important. The whole anti-hypertensive chapter is based upon this formula. Cardiac output into peripheral resistance. Okay. So blood pressure is equal to cardiac output. Cardiac output we have seen. Cardiac output itself is nothing but the stroke volume into heart rate. Okay. And peripheral resistance means the resistance that is offered by peripheral blood vessels. That is the resistance. Okay. Now blood pressure can be increased by either increasing the cardiac output or increasing the peripheral resistance. Blood pressure can be decreased by decreasing the cardiac output or decreasing the peripheral resistance. Okay. Whole anti-hypertensive chapter is based upon this concept. Okay. Remember, blood pressure is equal to cardiac output into peripheral resistance. Now, this blood pressure is increased. Okay, during the exercise. Blood pressure is increased by exercise and also increased by increased body temperature. अगर आपका body temperature increase होगा तो blood pressure भी increase होगा. So exercise also increases the blood pressure and body temperature also increases the blood pressure. So what is normal blood pressure? It is around 120 by 80 mm of Hg. Okay? Normal blood pressure कितना होता है आपका? 120 by 80 mm of Hg. Systolic blood pressure होता है 120, diastolic blood pressure होता है 80. Okay? So 80 millimeter of mercury millimeter. So normal blood pressure is 120 by 80 millimeter of mercury, or you can say in other words 16 or 16 by 11 kilopascal, Kelvin pascal. Okay, so remember the blood pressure. Now, if blood pressure is less than normal, if your blood pressure is less than normal, then it is known as a hypotension. If your blood pressure is less than normal, then it is known as a hypotension. If your blood pressure is more than normal, If your blood pressure is more than normal, it is known as a hypertension. If blood pressure is less than normal, it is known as a hypotension. Both are the disorders of blood pressure. Hypotension as well as hypertension, both are the disorders. Your blood pressure should be normal, within the normal range. Actually this 120 by 80 is not normal only, it is again a average. It is again an average. It may be little bit plus minus. Okay, it is just average, so it is not नॉर्मल. नहीं तो ऐसा नहीं होना चाहिए कि आपका ब्लड प्रेशर अगर 120 125 है और 80 है, उसका मतलब ये नहीं कि यू आर सफरिंग फ्रॉम हाइपरटेंशन, ऐसा नहीं है. सो दैट इज अगेन अ नॉर्मल. 120 by 80 is normal, 125 by 80 is also normal. हाँ, if you are suffering 135, if your systolic blood pressure is around 135 and diastolic blood pressure is around 85, then only you are suffering from hypertension. So remember what is hypotension, what is hypertension. Hypotension means less than normal blood pressure. Hypertension means more than normal blood pressure. Now control of blood pressure. Okay, so control of blood pressure involves two mechanisms, short term mechanism as well as long term mechanism. Now blood pressure is controlled by short term mechanism. Okay, on the basis of movement involves the baroreceptor reflexes. Baroreceptor reflex. So baro means pressure, receptor means okay sensitive. These are the specific protein molecule sensitive to the pressure change. These baroreceptors are located in the aorta. Aorta जो होता है वहाँ पे एक specialized protein, or you can say it is a CCTV that monitors the blood pressure. So pressure exerted by the blood on the wall of aorta, that is nothing but the aortic pressure, and at that aorta, arc of aorta, there is a baroreceptor that will monitor the blood pressure. If there is a decrease in blood pressure, they will send a signal to brain, and brain will again re-signal to heart to increase the heart rate. If blood pressure is more, baroreceptor will signal the heart rate. Baroreceptor will signal the brain. Okay, and then again this brain will give signal to heart to decrease the heart rate. And baroreceptor and chemoreceptors, they control the blood pressure for short term. Chemoreceptor means these are the again specialized receptor responsive. They are very sensitive to oxygen and carbon dioxide level of your blood. आपके ब्लड में कार्बन डाइऑक्साइड लेवल बढ़ गया या ऑक्सीजन लेवल, कार्बन डाइऑक्साइड लेवल, उसको मॉनिटर करने वाले केमो रिसेप्टर होते हैं. बैरो रिसेप्टर क्या होते हैं? प्रेशर रिसेप्टर होते हैं. एंड सर्कुलेटिंग हार्मोन्स आल्सो, बैरो रिसेप्टर, केमो रिसेप्टर, सर्कुलेटिंग हार्मोन्स, they will control your blood pressure for short term. Now long term control of blood pressure. How long term blood pressure is controlled? So long term control of blood pressure involves the regulation of blood volume by kidney through renin angiotensin aldosterone system. So there is one system known as the renin angiotensin aldosterone system. So if there is a decreased blood flow to your kidney will activate this system, renin angiotensin aldosterone system. Okay, and there is a series of event conversion of angiotensinogen to the angiotensin 1 and 2 by renin. This angiotensin secondary is a vasopressor, will increase the blood pressure. So baroreceptor and chemoreceptor, again you can see. So what do you mean by baroreceptors? I have already explained. Known as the pressure receptors, they are situated in the wall of aorta and carotid sinus. Blood pressure disturbed by movement, they will send the signal to the brain. Okay, they are sensitive for the pressure, and depending on their signal, brain will release the neurotransmitter. Chemoreceptors, okay, chemoreceptors, they are sensitive to the pH change or oxygen and carbon dioxide level of the blood. Now pulmonary circulation. Okay, pulmonary circulation means circulation of blood into pulmonary arteries and veins to the lungs. Okay, so circulation of blood to the lungs is nothing but the pulmonary circulation. Now if this pulmonary pressure if exceeds 25 mm of Hg, 25 mm of Hg, if pulmonary pressure is more than 25 mm of Hg, that results in the pulmonary edema. Okay, control of heartbeat and control of heart and blood pressure. There is a cardiac center present in medulla oblongata. It is a stimulatory and inhibitory center. If there is an increase in the blood pressure, it will send inhibitory stimulation, inhibitory signal. And if there is a decrease in blood pressure, it will send stimulatory signal. Okay. Parasympathetic vagus nerve is supplemented to a heart. It will decrease the heart rate and force of contraction, whereas a Sympathetic nerve. Sympathetic nerve will increase the heart rate and force of contraction via glossopharyngeal nerve. So that's how blood pressure, control of blood pressure is there. Now you can see again here movement of blood in the heart. So this venous blood, okay, these two veins, major veins, superior vena cava and inferior vena cava. This one is superior vena cava, it is inferior vena cava. They will collect the blood, which is known as a venous blood or impure blood. Venous blood or impure blood. Blood is having less oxygen and high carbon dioxide. So venous blood is having less oxygen and high carbon dioxide. That will be collected. That will be okay. This veins will deposit the blood into right auricle or right atrium. Right atrium, okay, right atrium will transfer blood to right ventricle. And during this transfer, this valve will open. It is known as a right. It is known as a atrioventricular valve or tricuspid valve. Okay, it will prevent the backflow of blood from right ventricle to the right auricle. Now, from right ventricle, blood will be pumped to the lungs via pulmonary artery. There will be purification of blood and blood will be transported to left auricle via pulmonary vein. ये pulmonary artery है, ये pulmonary vein है. There is exception. Most of the arteries carries oxygenated blood, but pulmonary artery carry deoxygenated blood. Most of the veins carry deoxygenated blood, but pulmonary vein carry oxygenated. Now, oxygenated blood or pure blood is there in case of right auricle or right atrium. This blood is transferred to left ventricle, and to prevent the backflow from left ventricle to right auricle, this is a bicuspid valve is there. Okay, from right ventricle blood is pumped to aorta. Now this blood is having high oxygen saturation and low carbon dioxide. यहाँ पे this side of heart has a impure blood and this side of heart has a pure blood. Remember. Now disorders of arteries. Arteries में कौन से disease हो सकते हैं disorders of your arteries. So first one is arteriosclerosis or arteriosclerosis. So it is also known as a hardening of artery. In this case, your arteries will lose their elasticity. Arteries will lose their elasticity due to deposition of cholesterol inside the arteries. Your arteries will lose their elasticity, known as arteriosclerosis. Okay, remember this. And this is a most of this arteriosclerosis is one of the most important cause for your heart failure, okay, or angina pectoris, etc. So arteriosclerosis is the one of the most important cause for angina pectoris. Okay, then second disorder of your arteries, aneurysm. Aneurysm means what? A weak portion of atrial wall may bulge out forming a sac bubble called aneurysm. तो यहाँ पे जो जैसे मान लीजिए कि आपका ये ब्लड वेसल है, ब्लड वेसल नॉर्मल है, तो यहाँ पे अगर कोई वीक पोर्शन है और ये ऐसा ऐसा बनता है वॉल, दैट इज नोन एज एन्यूरिज्म. ठीक है, फॉर्मेशन ऑफ बल्ज. ओके, so weak portion of atrial wall may bulge out forming a sac or bubble known as aneurysm. Okay, then remember arteriosclerosis one of the cause for aneurysm. Most common cause of coronary heart disease or coronary artery disease is nothing but the arteriosclerosis. So remember aneurysm was regarding this. There was a question in GPAT 2019 कि aneurysm क्या होता है, उसके बारे में क्वेश्चन आया था GPAT 2019 में. What is aneurysm? So there is nothing but a weak portion of your artery may bulge out forming a sac or bubble known as a aneurysm. कि ठीक है, नॉर्मली आपका आर्टरी क्या है, ऐसा स्मूथ होता है, लेकिन एन्यूरिज्म कैसा होता है? एन्यूरिज्म में क्या होता है? वीक पोर्शन ऑफ आर्टरी विल बल्ज आउट, दैट इज नोन एज एन्यूरिज्म. नाउ डिसऑर्डर्स ऑफ वेन्स. First one is the phlebitis. Again, this was a question in GPAT 2019. What is meant by thrombophlebitis? So it is the inflammation of vein due to intravenous injection. It is the most common in the legs because of the subjected to high blood pressure. So what is meant by thrombophlebitis or phlebitis? So if any patient is admitted in the ICU, intensive care unit, so at that time there is a continuous intravenous injection or continuous intravenous fluids are injected in that patient. Okay, and if you not rotate the intravenous side, what happens? Due to continuous presence of that syringe in the vein, there is a collection of blood cells, there is a formation of clot, there is a infection, and there is a inflammation. One is a phlebitis. That is the inflammation of vein because of the intravenous injection. And if you not rotate that site, so the intravenous injection will be very painful. I have experienced that. Okay, that is known as phlebitis or thrombophlebitis. This was question in GPAT 2018. Phlebitis or thrombophlebitis. Okay. Now next one is a varicose vein. Varicose vein means swollen or distanced veins that occurs in the most often in the superficial vein of legs. ठीक है. So इसमें क्या होता है कि जो पैर के जो वेन्स होते हैं पर्टिकुलरली पैर के बैक साइड के वेन जो होते हैं जो दिखते हैं आपको, ठीक है, घुटने के पीछे, तो वो वेन्स क्या होते हैं कि वो वेन्स इलास्टिसिटी खो देते हैं. Okay, so that is known as varicose vein. Okay, so swollen and distanced vein that occurs most often in the superficial vein of legs. People must, जो लोग ज़्यादा बैठ के काम करते हैं या फिर जो ज़्यादा स्टैंडिंग काम है इनका, उनको ये प्रॉब्लम होता है मोस्ट ऑफ द. So people who must sit or stand on the one place for longer period, so they develop varicose vein. Varicose vein may cause discomfort, cramping in the legs, and may become painful. Severe varicosities may need to be removed by surgically. Now hemorrhoids. What is hemorrhoids? Hemorrhoids. Okay, hemorrhoids means inflammation of your veins present in the rectal area. रेक्टम में जो जितने वेन्स है उसका इन्फ्लेमेशन हो गया, उसका डैमेज हो गया, तो हीमोरॉइड्स. Who is the result because of the pregnancy or chronic constipation and staining to defecate or straining to defecate means if there is a constipation and if you are forcing the stools forcefully, that may result in the hemorrhoids. It causes discomfort, pain, and they can be removed by surgical. So, thrombosis means what? Formation of clot of blood inside the blood vessel, known as a thrombosis. Embolism means what? Movement of that thrombus into various blood vessels. Okay. Blocking of blood vessel by any mass of material, known as embolus or embolism. Thromboembolism means a mass, that is a mass of blood clot plus other material that moves from one vein to another vein, known as a thromboembolism. Now, diseases of heart. First disease is known as a arterial septal defect. It is also known as a hole in the heart. आपने सुना होगा कि बच्चे के दिल में छेद है. So that is known as a atrial septal defect. Then next one is a Fallot tetralogy. Fallot's tetralogy. It is a congenital cardiac abnormality of 4 combination. तो इसमें क्या है? Stenosis, ventricular septal defect, aortic misplacement and right ventricular hypertrophy. मतलब यहाँ क्या होता है? स्टेनोसिस मतलब ब्लॉकेज. वेंट्रिकुलर सेप्टल डिफेक्ट मतलब क्या? दो वेंट्रिकल है, राइट वेंट्रिकुलर एंड लेफ्ट वेंट्रिकल, उसके बीच में एक पार्टीशन होता है, उसको बोलते हैं सेप्टम. ओके, partition between left ventricle and right ventricle is known as a septum, and if there is defect in this septum, that is known as ventricular septal defect. Aortic misplacement. Aortic misplacement means कुछ कुछ लोग कुछ सब्जेक्ट का हार्ट जो है वो रॉन्ग साइड में, जैसे मोस्ट ऑफ द लोगों का most of the people will have heart on left side. There are few people who have heart on right side. So aortic misplacement and right ventricular hypertrophy. So that is a Fallot tetralogy. Now rheumatic heart disease. Rheumatic heart fever is an inflammatory illness that sometimes follows subtropical throat infection, most commonly in the children and young adult. It is an autoimmune disorder. It is to combat the original interaction antigen damage connective tissue including heart joints. So that is a rheumatic heart disease. Now sequence of blood flow in the heart, we have already 2-3 times we have seen. So your blood will be received in the from upper part from superior vena cava and from lower part from inferior vena cava, and that will be collected in the right atrium or auricle. Tricuspid valve or atrioventricular valve prevent the backflow of blood from right ventricle to the right auricle when ventricle contracts. Blood from right ventricle will be pumped to the lungs, okay, via 4 pulmonary veins. They receive blood from lungs, they will be received into left atrium. From left atrium blood will be pumped to left ventricle, and mitral valve or bicuspid valve will prevent the backflow of blood from left ventricle to left auricle. We have seen this sequence of blood flow 2-3 times. Heart is a double pump. Remember, heart is a double pump. Okay, heart is nothing but the double pump. Right side of heart receives deoxygenated blood from the various body part and pumps the into lung, whereas the left side of heart receives pure blood from lung and pumps it to various part of body. So at a time it is doing two things. Okay, collection plus circulation. That's why it is a double acting pump. Coronary artery supplies the oxygenated blood to myocardial muscle of heart, and coronary vein will carry deoxygenated blood from myocardium. Okay. Blockage of coronary artery or obstruction of coronary artery may cause myocardial infarction. Now, last slide. This is again very important. इसके ऊपर भी क्वेश्चन आ चुका है. Types of shock. First is known as a cardiogenic shock. So cardiogenic shock means what? It is mostly because of the myocardial infarction and maybe because of the result of ventricular fibrillation. Ventricular fibrillation means excessive ventricular contraction, more around 350 contraction beats per minute, known as a ventricular fibrillation. In the both cases, heart will be no longer remain as an efficient pump and it fails to pump the blood. Cardiac output decreases. That is known as a cardiogenic shock. Now what happens in the cardiogenic shock? जो आपका हार्ट है, हार्ट आपका ब्लड पंप नहीं कर पाता, insufficient blood pump कर पाता है. So decrease in the cardiac output. So in cardiogenic shock, you have to use positive inotropic drug and positive chronotropic drug like digitalis, then adrenaline, okay, etc. In case of cardiogenic shock, noradrenaline, isoprenaline is the drug of choice. Isoprenaline is the drug of choice. Now second type of shock is a hypovolemic shock. Hypo means less, volume means amount of blood. Hypovolemic shock means less amount of blood, because of less amount of blood. Okay, so as a result of decreased blood volume due to severe blood loss, अगर आपका वेन में या फिर आर्टरी में कट हो गया तो severe blood loss हो जाएगा आपका. Okay, due to damage to the blood vessel, result of decreased blood volume due to severe blood loss due to damage in the blood vessel or extreme sweating, ज़्यादा sweating हो गया है, ज़्यादा heat shock, diuresis or diarrhea, excessive fluid loss due to diarrhea, diuresis. So that leads to decrease in the blood volume and known as a hypovolume or hypovolemic shock, and it is known as a hypovolemic shock. Okay, because of blood loss, blood volume decreases, blood decrease in the blood volume decreases the cardiac output and heart will fail. Okay, and this is known as a hypovolemic shock. This was question in GPAT 2019. You can go and check the paper. Okay. Now this anaphylactic shock also they comes under this category. Anaphylactic shock also comes under this category. So we have seen the cardiogenic shock and hypovolemic shock. Okay. Now next is nothing but the septic shock. Next one is nothing but the septic shock. Septic shock means septic होना मतलब क्या है? So it is related with the infection. It is also known as a bacteremic or endotoxic shock. Remember, okay, bacteremic or endotoxic shock, and it is because of the toxins and bacterial infection which triggers the massive inflammatory and immune response and release of powerful mediators of inflammation like histamine, bradykinin, serotonin, etc. It can damage the multiple organs. It can decrease the myocardial contractility also. Tissue perfusion rate also will be decreased and there will be death, known as a septic shock. Types of shock important है. So first one was cardiogenic shock, second one was a hypovolemic shock, third one is a septic shock. Now next one is a neurogenic shock. तो septic shock में क्या है, इसमें आपका रहेगा antibiotics यूज करना पड़ेगा. You have to use antibiotics in case of septic shock. In case of hypovolemic shock, you have to introduce directly a blood. Okay, blood transfusion will be there, or you have to introduce various fluid and electrolytes in case of hypovolemic shock. Okay, remember. Now neurogenic shock means sudden acute pain, several emotional experience, spinal anesthesia, spinal cord injury that can result in the neurogenic shock. Neurogenic shock means damage to the nerve. Suppose that आपका spinal cord कोई injury हो गया, so that will result in the neurogenic shock. बहुत ज़्यादा pain हो गया आपको, so that can result in the neurogenic shock. बहुत ज़्यादा emotional वगैरह can result in the neurogenic shock. Now next one is anaphylactic shock. Okay, anaphylactic shock means severe allergic response to various antigens. Now this is triggered by individual. Okay, it may be due to different For example, the chemical may be the antigenic property may be of chemical origin, it may be of drugs, or it may be of different thing. So you have seen a lot of people. Some people will have allergy of peanut, some people will have allergy of rubber, some people will have allergy of penicillin. So introduction or ingestion of such, some people will have allergy of your mushroom. So ingestion of mushroom will result in the anaphylactic shock to that person. If person is allergic to vitamins, introduction of vitamins or injection of vitamins to that patient will result in the anaphylactic shock. So severe allergic response will be there due to triggering of antigen antibody reaction due to that antigen. Antigen may be either drugs, peanut, latex, rubber, or vitamin 6. Factors such as antigen and triggers the anti-inflammatory reaction, release the mediators like histamine, bradykinin. Okay, so in that case, in case of anaphylactic shock, adrenaline is a drug of choice. Remember, adrenaline is a drug of choice in case of anaphylactic shock. So this was regarding the circulatory system.